It will be his Waterloo. It will break him. Think about that. This isn't about me. This isn't about politics. This is about a healthcare system that is breaking America's families, breaking America's businesses, and breaking America's economy.
Well, one Republican senator joins us. Senator DeMint joins us live. He's also the author of the book, Saving Freedom, We Can Stop America's Slide into Socialism. You're now one Republican senator. It's an interesting title.
Yes, it is.
All right. You said this comment about Waterloo. Why did you say that?
Well, if we don't put the brakes on the president, he's going to break our country right now. And the last time we let him ram something through Congress, we ended up with this catastrophic stimulus failure that's hurting our jobs and mortgaging our future. And now he's trying to push this $1 trillion health care bill through in 2 weeks before we go home on the August break. And we've got to slow him down. And Greta, that's what I hear from Americans more than anything else. Slow down. Read the bills. Find out what's in them. The president wants to go too fast. We need to put the brakes on.
All right, I'll tell you what horrifies me is this bill, at least it's rumored to be about 1,000 pages. Is that right? The one
it's well over that.
Okay,
yes.
well over 1,000. Do you know any member of the House of Representatives or any U.S. senator who has either read it or plans to read it before it's voted on?
They won't, and there are actually 3 versions of it now. There are 2 in the Senate, there's 1 in the House, and the president probably has some variations of his own. And he's admitted he doesn't know what's in these bills, yet he's out giving all of these glowing promises about it. And the people who are reading what has been put out say it's not going to do what he promised, it's not going to cover people with health care, and we are going to lose our private plans.
Well, who's doing this reading? Is it lobbyists and staff members? Are those the ones doing the reading? Because I have yet to find a House member or a senator who says, yes, I've read these 3 versions start to finish. Who's doing this reading?
Well, you can look at the language and see the plaintiffs' attorneys have written a lot of it because there's no tort reform in it, and there's actually more liability.
Well, we could debate that one. I mean, you and I can go down the road on that one. We just read today about a poor guy who went in for a gallbladder and lost both his legs or something. Yeah. So, I mean, you and I could fight about that one, but go on.
No, but they haven't read it. It's a compilation of what staff puts together, and different congressmen say, I have to have a public plan, I have to have this in there, and it comes together, and they want to pass it before anyone reads it. That's why the president wants it done before our August break. If it hangs out there during the month-long August break, people will put it on the internet, the radio talk shows will pick it up, the bloggers will pick it up.
So we'll see what it is, essentially.
We'll find out what's in it, and all the independent groups that have looked at it so far say it's not going to get the people insured that the president says, and we will lose our private policies. So his promises are not true. I'm just trying to use whatever language I need to get his attention and the American people's attention. The fact is, Greta, he's not for reform. He voted against everything that we put up for health care reform when he was in the Senate. What he wants is the government to take it over, just like General Motors or AIG.
But I don't even know, I mean, frankly, I mean, that's not an appealing way to do it necessarily for me. But what I don't understand is that how can I even know if the option is appealing when we don't even get to see it, and the people who vote on it don't even get to read it, and people are just jamming all sorts of things into it. You know, it's to the American people, it's like as they sort of sit back and listen to this, I imagine they're thinking, why do we send anybody to Washington if it's just going to be, you know, throwing it up in the air and see what sticks?
If it was really what they said it was, they would want us to read it. But they don't want us to read it, Greta, and I'm afraid we've been doing that way all year.
That's got to stop. That's got to stop. You guys got to start reading what you vote on.
We do, but you know, if you have over 1,000 pages of legal language that refers to numerous other bills, that you can't read that even in a week. You have
but this one's so profoundly important that at least take the time for this one. People, I mean, this is going to redefine how we do health care for generations, probably.
It will, and it's 1/5 of our economy, and they're talking about taking it over with the government. So I think, and that's what I'm saying, that we have to stop the president, or he's going to knock this one out and go on to cap and trade, which will put a tax on electricity.
Do any U.S. senators, Democrats across the aisle, do they ever come up to you in the hall, and I won't make you out their names, and say, you know, boy, this is really bad. We got, you know, we need to put the brakes on so that we can actually read this to see what this bill is?
Well, they haven't said that to me, but enough of them have said it to their constituents back home that they have concerns that I can tell that they are at least thinking about this. We've got to make them more afraid of their voters than they are of the special interests that are basically drawing up these bills.
Well, you know, I wish that they would make a pact with their voters. You know, a lot of them made pacts like on term limits and stuff. I'd like to make a pact with the voters on something that's so profoundly important. Make the pact that, that the senators and congressmen will actually read it before they vote on it.
There are people passing out a petition, and I've signed it, that before I vote on a bill, I'm going to read it. Now, I'm going to vote against a lot of them when I don't get a chance to read the whole thing.
Well, I mean, there is no transparency if nobody bothers to read it, if it doesn't go up on the web and it just gets rammed through, whether it's a good bill or a rotten bill.
Let me say one thing just to clear the record on it. Republicans have put forward much more health care reform than the Democrats. The
Historically
Democrats
or now?
In the last several years, since I've been in the Senate. Affordable and accessible to have their own insurance when they don't get it at work. He's saying we don't want to do anything. The facts are against him. We've tried to reform the system. Now he wants the government to take it over. We need to stop him.
Senator, thank you.
Thank you.
All right, time for all of us to confess. Admit it. You are just as confused as we all are about the proposed health care plan. Joining us live to sort it all out is Adriel Bettelheim, White House correspondent for CQ Politics. Can you sort out this health care bill for us? What is it?
Well, we're trying. There are several drafts circulating, as the senators said, in the House and the Senate. They both try to do two things. They try to cover the uninsured population, about 48 million Americans who lack coverage, and they're trying to do it budget neutral, meaning this plan will pay for itself.
Is there, okay, now I saw the report from the Congressional Budget Office. Is there any chance that the current three versions that are floating out there, that they will pay for themselves?
Well, I mean, the projections are saying that they'll swell long-term costs instead of pay for themselves. These are still drafts, and I think you sort of have to view them as works in progress, particularly since the Senate Finance Committee, which a lot of people look as the fulcrum in this debate, have yet to mark up their bills. So I don't want to say these are stalking horses yet, but I think there's a lot of work yet to be done.
All right, if they're going to pay for themselves, why do we hear about tax increases, surtaxes on different income strata? That doesn't sound like it's really going to pay for themselves. It sounds like that they're really going to go out and get extra money from other people to pay for itself. So it really isn't. It isn't cost neutral. That's a lie.
There's two ways to pay for a health care overhaul. You tax people, or you try to squeeze efficiencies out of the health delivery system. And to do the latter, you press providers, doctors, hospitals, whomever, to squeeze new efficiencies, come up with hundreds of billions of savings.
That would be cost neutral, I think.
Well,
I would consider that cost neutral.
That gets you part of the way, but then you still have to raise taxes, and that gets into a very sticky political debate over who.
So that's a lie, though, to say that's cost neutral. When you have to start to go out and get more money, it's not cost neutral. It does cost somebody, right?
Well, they're saying the total package, when you net everything out, will be neutral over 10 years.
But, I mean, does that mean that these people won't get tax increases?
Well, depends who will.
It sounds a little bit, I'm a little confused, I must admit.
They're trying to aim at the wealthiest Americans, and he said this much when he was campaigning, that they were going to try to levy surtaxes and eliminate deductions for the wealthiest Americans, but that's not going to make all of the math work. Some people are suggesting they go after the tax exclusion on employer-provided health coverage. A lot of Republicans say that's a good idea. That would force him to kind of go back on a campaign pledge, and he doesn't want to think about that right now, but there may be a fallback yet.
Have the Republicans proposed any plan, or are they just criticizing this one?
No, I think they have some plans out there. They have ways that businesses could get around regulations and have more liberalized purchase of insurance. It is not the big all-encompassing plan as touted.
So they're not
by
just
Obama.
saying no. They're not just saying no to the president. They're saying that these are some options of what we would like to see.
I think no. There are proposals out there. I think some Republicans genuinely want to work with this administration. Others are putting honest alternatives, and still others are kind of dug in and just have a philosophical ideological problem with the government playing as big a role as Obama would like it to.
Have you come across any member of the House or Senate who is at least bit sort of, feels a little bit bad about the prospect of voting on something having not read it? Something so profound that could restructure our society so profoundly.
They're not going to vote on it anytime soon, except if they're in the relevant committees. Obama was talking about having a vote before the August recess. That's looking almost impossible.
But how about the concept of actually reading it? Because I mean, that's the thing that I know that they vote on a lot of things they don't read, but this is different. It's like the bailout bill that they didn't read. Are any of them? Do you know anyone who's actually going to read this?
One would hope, over the August recess, as they see this coming together, they or a staffer or someone will at least summarize it, and I would guess they'll know what they're getting into. But I can't tell you that everyone is going to read every word. Those are big bills. They're
big bills, but yet that's their job, isn't it? Sort of. I mean, like, isn't that, I mean, like, why do? See, I don't get this. Is it if they're not going to read them, why do we even need them? That's the whole point. It's like just, I guess, to vote general concepts. I guess I don't know. But anyway. Anyway, the American people are getting. At least I'm getting a lot of emails. People are mad at that. But anyway, thank you very much.
My pleasure.